Thank you for staying with us here at 4:30. I'm Kirsten Joyce.
And I'm Brian Loftus. Testing and treatment for HIV was stalled during the pandemic, and now another obstacle could limit that progress even further.
A Texas judge struck down part of the Affordable Care Act last month. It requires most insurance to provide an HIV prevention drug for free.
And as 8 News Now reporter Ryan Matthew shows us, the ruling could go far beyond just HIV.
How much do I pay for that? $0.
33-year-old Akeem Rowlands found his queer community at just 15, then began exploring.
What kind of sex do I like? What kind of sex don't I like?
Then, during a routine visit with his doctor, she asked,
"Why aren't you on PrEP?" And I said, I don't know. I don't really know that much about it.
This is PrEP, or pre-exposure prophylaxis, a once-a-day pill that the CDC says reduces the risk of getting HIV dramatically through sex or injection drug use. The Southern Nevada Health District reports over 4,300 users in Clark County alone.
When I engage sexually with another person, there's something not here anymore, and that thing that left was anxiety or fear that was always there afterward.
We're at a place where we can end the HIV epidemic, but this is going to stop that progress.
Now, a recent ruling in Texas could restrict access nationwide. The Affordable Care Act currently requires most insurance plans to cover the prescription along with other preventative services not related to HIV. A federal judge in March struck down this provision of the act, arguing the task force who chooses which preventative services are eligible for coverage was not appointed by the Senate and unlawful.
It means that if you were going in for your mammogram, you would suddenly have to pay for that instead. If you want your HIV or STI screening, you'd need to pay for that instead of being able to get that for free. That reduces access for people.
And it comes as Clark County begins to see rising HIV diagnoses in all genders that it hasn't seen since before the pandemic.
The pharmacist said it was $3,000 for me to get PrEP.
A biomedical HIV prevention summit at the Cosmo Hotel this week, emphasizing the need for this drug beyond just the queer community.
We are all HIV possible. So we are all susceptible and potentially vulnerable to HIV.
The Biden administration is currently appealing a Texas judge's decision. Meanwhile, our state does rank 5th in the nation in terms of positive HIV cases. For the time being, PrEP and these other preventative services are still at no cost under most insurance plans.